one patient working with walker. Look, the right foot is not a normal. Walking with right foot is a normal way. Watch carefully. This man is working with walker, suffering from herniated discs and mainly spinal canal stenosis. The MRI report is saying that spinal canal stenosis is suffering from spinal canal stenosis. Watch carefully. Age about over 75. Watch carefully. This foot is this foot, and then this is not a proper way to up both heels. Hold in walker and up and down in both heel. Both heel up and down. It is a normal way. Not a proper way to watch. Watch carefully. And this is the hemiplegia patient, is a left foot paralysis patient, is working, the movement is legs. Watch. Leg is not a proper way to movement. Falling down. Watch carefully. Not a proper way to stand his leg. Not a proper way. Watch carefully. He is standing, but his left leg is not a proper position. His left leg is not a proper position. Watch carefully. Now his leg is proper position and he stand up and hold. Stand up and hold. Watch carefully. Stand up. Both hand up with balance. No, he is falling. Watch carefully. His left leg is not a proper position. Not movement is left leg is proper way. Not movement proper way. Now see. Stand up. Both hand up. But his leg is not a proper position. Watch carefully. Movement laterally is left leg. This is the foot drop patient. Watch carefully.
Today's video is foot drop. Foot drop is a very difficult disease. It is the recoverable positions for this disease. The two technique is there. One technique is the gastrocnemius muscles. It is called gastrocnemius or calf muscles. It is the do that pressure is here. Do pressure is here. Pressure is here. And look. Pressure is here. The pressure is here. Pressure is here. And this tendo achilis is movement. Tendo achilis is movement is here. Tendo achilis. Do regularly. It is the one part. Do regular basis. One part. It is the gastrocnemius muscles is downwards pressure, and it is the movement is there. It is a movement is there. And in another is do that pressure 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is the tendo achilis regions. It is called tendo achilis. The tendo achilis is a spring action is when we were walking. It is a tendo achilis function. It is a tendo achilis function. It is the pressure on that positions. The movement is tendo achilis. Pressure on that positions. Looking carefully. The tendo Achilles, this movement is there. Tendo Achilles movement is here. Tendo Achilles movement is here. Tendo Achilles movement is here. And the tendo Achilles stretching upwards and hold 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It is the process to drop foot recovery. The one technique is this is the pressure is 10 to 20 seconds, and then press this side 10 seconds. And I show that it is the process, it is the technique. This is the way of this calf muscle and gastrocnemius muscle is here. It is the press down, and tendo Achilles is here, its tendo Achilles is here. It is the up and down, up and down, up and down. It is the movement is there, up and down, up and down, up and down, up and down. And that's the two things we are doing, and it is the recoverable position. I agree that it is. I prove that any GBS patient or any hemiplegia patient or any neuro patient is recovering that these things.
Technique of this patient is right leg is a normal way, right neck. Look, right leg is a normal, and left leg is a normal, not a normal. Left side hemiplegia patient is not a movement properly. And then see, watch carefully. Is not a movement properly. Hold on your hand, and watch carefully. Hold carefully. Then movement is not a proper way. You have to press these positions. This taking easy way. This is a normal leg press in gastrocnemius and soleus muscles. Then see is a foot is elevated in upper positions. Hold and press on that positions, and foot is. But left leg is hemiplegia patient is giving these positions and pressure down, giving these positions and pressure down and up and down. Please check out and list it. Watch. Pressure on that positions and his palm. Phalanges is movement, palm is movement, and also watch the tendo Achilles movement is there. Watch his tendo Achilles is movement. Pressure on that position is that it is the pressure on soleus muscles or gastrocnemius muscles. Press soleus muscles and gastrocnemius muscles. Pump it and press it. Watch carefully. Watch carefully. Pump up. Pressure on that positions and his movement. Press. Watch carefully. The tendo Achilles position is watch. Press on that position, the tendo Achilles movement is there. It is a very useful exercise for foot drops. Very useful. And this is the tendo Achilles positions. The tendo Achilles. This is the tendo Achilles. And pump it. This is the positions of tendo Achilles. It is the spring action positions called before. Pump it, pump up, and then stretch, then stretch, then stretch, then stretch. The tendo Achilles position is pressure wise and giving pressure in dorsiflexion positions. Dorsiflexion positions. Watch carefully these muscles positions. Watch carefully the muscle position. Watch carefully. Stop. This is the position of tendo Achilles. The pressure. Holding positions. Hold that positions. The tendo Achilles is pressure wise in upwards, and dorsiflexion is Phalanges is pressure on dorsiflexion positions, and it is the stretch out of hamstring, and also the pressure on soleus muscles and pressure of tendon Achilles. Watch carefully. 10 to 15 times, morning and evening, giving this power and giving this exercise, betterment of our foot drop patients. I assure that it is the process to solve foot drops. And this is the giving left side paralysis patient. Watch carefully. This exercise giving foot drop development. This exercise. And this is the way to develop core muscles of the back. Core muscles of the back. One leg up in another leg, right leg up in left legs, and his gastrocnemius or calf muscle swing. There is the muscle is moving up your hip joints and pressure wise. Development core muscles. And watch carefully. Pump up your muscles and watch carefully. Leg is up and down. The phalanges movement. The tendon Achilles movement is there. Watch carefully. Watch carefully. The tendon Achilles movement is a proper way. You have to be pumped. Any GBS patient, Guillain-Barré syndrome, or any neuro patient, or any paralysis patient, this is the positions to pump up, to develop foot drops. This is the position of soleus and gastrocnemius muscles. Pumped up the positions. Watch carefully. And one neuro patient is functioning their hip up and down, both legs up and down. It is the development of foot drops and development of soleus muscles, gastrocnemius muscles, and also the core muscles of the back, and develop of thigh muscles, group of thigh muscles. There is a develop of also be powerful of this group of muscles and develop foot drops. And watch. After effect, watch. Not a foot drop. You see, it is easy to work. Watch carefully. Not a foot drop. It is watch carefully. Normal. It is a normal way to solve foot drops. Watch carefully. It is a normal. After exercise, he is a normal.